Coming up next on Mental Health Matters with Marty, featuring House Calls with Dr. Allen. Now that the Johnson & Johnson vaccination is off the market, what do? We have some questions. We got the answers also. Stay tuned. What's up, everybody? Come on in the room. I am Martina Sellers, your mental health hygienist, coming to you live and in living color all the way from Southern California, where the sun is always shining. And we are on this, it's another Wednesday, on another special edition of House Calls with Dr. Allen. And we always have the house resident physicians in the house, and we have a lively conversation that we are so excited. So listen, put people in the chat right now. Come on in the room, get everyone you know, because we have some important stuff to talk about. We are still talking about this vaccination. And again, this show is intended to be for a psycho and medical educational purposes only. Again, hear me when I say this. We are strictly for educational purposes only. We are not your primary care doctors. We are not your primary care mental health therapists. So we are just giving you our best educated advice in that. You cannot take us to court and sue us. No, baby. So don't even try. Don't even think about it. We got insurance to cover that anyway. Listen, but if you're experiencing any type of medical emergency or psychiatric emergency, please call 911 or go to your nearest emergency room for treatment. But I am so excited. Listen, get people in the room. Come on. Let us know you're listening and where you are listening from, because we have a conversation for you tonight, because we are still anxious and scared about this vaccination. Come on, people. We got to do better. Let's not be stereotypes out there and continue to live in fear. So I want to see some names in the chat right now. Invite them in. I want to give you about 30 seconds. Invite the people in. Let me know you're listening, where you're listening from. Come on. Yes. Love you, doctors. That's my mama. Come on. Crystal. Hello, Crystal. Yes. Come on in the room. Let us know you are listening, because we got the doctors here and you don't want to miss it. But I am so glad that I have my co-host that's with me every other Wednesday. She's doing an amazing job. She is also one of the co-sponsors of this with the Gardena Women's Center, none other than my sister from another mister. We've been knowing each other since we've been in college at UC Berkeley. Go Bears. None other than Dr. Gwen Allen.
Good afternoon. What is it? I don't even know what it is. I've been up here so long. I'm tired, but I love doing this. Thank you, Marty, again, for having me on. I'm excited. We have a lot of information to give out today.
Yes, we do.
And I'm just excited to come on and just talk about it, just to let people know that, hey, COVID is real. COVID is still out there, and we must address the concerns and the concerns of the people of brown and black, that they have to understand that this is not over. This is not a game. And we need to continue to talk about it, talk about our community. California is opening up. The freeways are horrible. Everybody is out there, and my phone is ringing.
All right.
But we have to understand that, hey, this disease, we have to address it. You come around, you're saying that, the weather is great.
Hey,
I'm going to take my top off, I'm going to hang out. And we're just forgetting that this thing is still out there and it's still killing people and it's still killing us. And so we need to address that.
Thank you.
That's one of the things we need to do.
I totally hear you, because it's still killing, and we are catching it still at disproportionate rates due to other comorbidities that are prevalent in our communities. And we can no longer, I say it this way all the time, Dr. Allen, we can no longer suffer in silence in the shadow of shame. And I'm going to add in there of ignorance as well. So people, do me a favor. Get people in here tonight. This is too valuable of information that you don't want to miss. Type some people's name on the in the box in the section there. Get people, call them on the phone. You are getting wonderful advice. You're getting firsthand advice that you get to ask actual doctors who are fighting in our communities, trying to bring us the best advice and give us the best help that we can get, that you're getting for free. Yes. Rosie, hello. Yes. Dr. Allen, what do you want to tell the people as we are definitely still in this battle?
Right. I would like everyone to know, like you said, we're in this battle, and this battle is not ending. We have to protect ourselves. If you want to go back to the life that you knew before, protect yourself, wear your mask, get vaccinated. And that's what we're refusing to do. All this other stuff going on in the news, I am so happy for the verdict. But however, we have to think about our individual health as well. Because you got to understand that the media put things out there that they want us to hear about. So if we don't hear about COVID, we don't hear about people dying anymore, we don't hear about the vaccine being recalled, we think it's over. It is not over.
It is not over.
And I want also people to know, like you said, come and talk to us. Quit talking to your friends. The myth, you don't know anything. Talking to people who have no medical knowledge or just have a lot of conspiracy theories. We are now 6 months into vaccinations, and as you can see before. And like I said before, I don't have a horn. I don't have scales. I'm still here. I have not got the vaccine, and I'm still on the front line fighting people day in and day out. So people, you just really need to come in. You need to come and listen and understand that you are still at risk. Get the vaccine.
Virginia,
and I think that's what they understand, that get fully vaccinated, and then you still have to protect yourself about the variants that are out there as well.
Yeah, I love it, because we have to have these conversations. We got to tell the truth about it. I love you. Listen, I'm fully vaccinated, don't have any horns. I caught COVID back in July, and listen, I don't ever want to go through that again. That is I've never been that sick for that long in my entire life. And it does started to mess with my psyche. And I'm a mental health professional. I had to tell myself the very same things that I start telling my patients. And I said, this is not the end, but it did remind me that I have to be healthier. Especially I'm a little older than 50, but just a little. Come on, Jerron.
I'm not there yet. I'm not 50 yet. I'm not 50 yet, Marty.
Yes,
I don't know what you're talking about.
I love it, Angela. Yes, y'all tell us. Get fully vaccinated. Who else on here is fully vaccinated? I know we saw Crystal said she's got some vaccination and all that.
And I'm fully vaccinated as well. And I've been fully vaccinated since December. I was one of the healthcare providers that was early on when they first gave it out. And so I was a part of also some clinical trials. So therefore, I am firsthand knowledge of that. We don't really have many side effects that people saying, oh my God, I don't want to take the vaccine because all the side effects. What side effects? I'm living proof that I have the arm soreness or something like that. But other than that, as far as side effects is concerned, not many, none. I didn't have any. So.
And then, I had just a little bit, and it was just a small migraine and a little bit of body aches that maybe lasted for 12 hours. But thank you, because I listened to your advice that you personally gave me. I took the Tylenol, I got my rest, and it helped me out tremendously. So y'all, that little less than 12 hours is definitely better than being 3, 4, 5, 6 weeks or death.
Right.
I'd much rather have 12 hours of a slight discomfort than death.
And I agree with you, Marty. I mean, people are like, oh, I'm going to have a headache and this and this and the other, but you're going to die. You sit out there, and now you can go to the restaurants. They're opening up. Some people are not wearing a mask, and you are taking chances. And also people are coming around you indicating that, oh, I have the vaccine. We're not having we don't have a glow on us to say, oh, you're vaccinated or something on our head to say that I am vaccinated. So you're in a room full of people and you don't even know if they're vaccinated or not, and you're taking off your mask. You're putting yourself at risk. Let's stop that, people. Let's protect ourselves. Let's protect our loved ones. And we want to be around later on to make sure that everything is okay.
Love it. I love all these people saying they didn't have side effects. They only had a sore arm. Thank you. This is the message that needs to get out. So people know, Virginia, no side effects. I love it because there are so many people who are taking what they hear on the news, what they hear other people say, and running with it. Everyone is built differently. Everyone's, just because if I'm out of shape and I've been eating wrong, yeah, I might have some side effects, even if I'm healthy, but it doesn't matter. That's what we have to do. Says, and let's not forget that our children can't get vaccinated. Yeah, that's right. We need to protect them. Yes.
Right. You have to protect the children. You have to protect the elderly. And now we have our teenagers out there just having a good time. But they're the one that's out there infecting the older population because we're more at risk, even though I'm only 20. Now I'm lying. The 50-year-olds, when you come in, you have a house full of teenagers, and the teenagers are going to parties, hanging out, and being careless. Let's talk to our teenagers. Let's talk to our 20 and 30-year-olds to say, hey, still protect yourself and protect me. What's really interesting, I thought about this the other day. I had a patient who came to me. I don't know if she's on the show or not. And her husband got COVID. How did the husband get COVID? Because his boys around and they smoking on a joint, passing the joint. And then now you found out homie has a COVID. And now you didn't pass it on to him because you didn't smoke the joint after him. And now you took it home to your family, your kids, and your pregnant wife. So we have to be very, very cautious of what we're doing and how we're doing these things.
That's right. We have to. Well, Dr. Allen, I'm so glad that we are not just the only ones on here, but we have our resident doctors that join us. They are just a part of this show as well. So glad to have them. And, she just came out of surgery and just came and did what she had to do. We're glad to have none other from Chi-Town herself, Dr. Jamie Horn.
Hi, everyone. Good to be here. I am going to get the back down. I am at work, so if I have to run out, I have a couple people in labor. Just happy to be here.
And fully vaccinated.
I do like how people are putting in the comments that they're fully vaccinated.
Yes, me too.
Please tell your friends. You are like the best advertisement for the vaccine. If you went through it, you survived, get your mom, your sister, your best friend. Take people. Here in Chicago, they are now having walk-ups. You can go to the Tinley Park. You can go to the Madison Community Center, 16 and over. You don't even need to make an appointment. All you need to do is walk up and say, I want the vaccine. So please take your friends, take everybody out there to get the vaccine.
Love that, because we no longer have an excuse. We can get it. Go get it. And then from Lake Charles herself, she is the one, she's got the nickname now, the saucy doctor. Yes, she got a little sauce on her. None other than Dr. Gisselle McKinney. Definitely.
Hello.
Come on.
Saucy here.
Yes. Listen, my mother still loves you. You got a fan club.
Tell her I said I love her too. Yes, another one of us that is fully vaccinated and have been fully vaccinated since January. We also have walk-up clinics that are giving the vaccine. You can walk up to Sam's. You can walk up to Lake Charles Hospital on Oak Park Boulevard. You can even walk up to the women's campus. There are multiple places within this community where you can get a walk-up vaccine. The biggest thing people are saying now is that it affects that'll make you sterile. I have no idea where they're getting this from, but the dark web and the QAnon is really real, and people are making assumptions about nothing that has anything to do with reality, but that's the world we live in.
That's right.
So we have to come to the idea that if the vaccine is making you sterile, what it isn't making you is dead. The vaccine first shot is I felt absolutely nothing when I took the first shot. The second shot, how it did make me tired. My arm was sore. I felt I took Tylenol and went to bed, and 12 hours later I was as good as new. All of my children are vaccinated. My youngest is 19. They are all vaccinated in my household, including my husband. So what I do know is we recently lost one of our class members who in Atlanta qualified for the vaccine, called everybody that was there that was from our class to get the vaccine. He, however, did not. Thought he had a sinus infection, and then subsequently found he was COVID positive and died.
Wow.
So you can feel like you're going to live forever and that you can do well, but it's not the case. Our community is suffering at an extremely disproportionate rate than anyone else. And we have discussed this countless times about why, but we also are the ones that are not getting the vaccine. And it bears for our discussion today how important Johnson & Johnson was, because we were using that vaccine as a one-dose treatment in the poor, rural, and other communities to get us vaccinated in a rapid fashion. But now it's pulled, and I'm not sure why, because it doesn't make sense.
Yeah, so let's have that conversation. Let's have that conversation about Johnson & Johnson. Dr. Allen, I know you have some statistics and things that you want to definitely talk to us about. Listen, that life of a doctor, we're always busy. You see, I put myself in there.
And my phone ringing, all kind of stuff is happening. People don't even just allow us to rest. I'm on call tonight. You hear my ring, my phone, everything. But let's get back to the question at hand. And what we were talking about before, let's start all over. Johnson & Johnson is a household name, and this is just me talking now. That don't take me for that. A lot of Black folks, I would say people of color, took Johnson & Johnson. Oh, I'm gonna wait for the Johnson & Johnson vaccine. Why? Because it was a household name. It is a household name. And so we felt very safe with that. No one really talked about Pfizer. No one talks about Moderna. No one talks about anything else. What we heard was Johnson & Johnson, and I'm going to wait on that. However, in the process of doing so, we got left behind. There are millions and millions of people have been vaccinated for almost 6 months out of the game, and people of color have been left behind again. As Gisselle said, that they went to rural communities. We're trying to get the vaccine out to everyone, and then you get the one dose. We get the one dose. It's been out for, let's say, a month. It's been out for a month now, and now they're saying that, oh my God, people are getting blood clots, and they know what we do as people of color. You know, you tell one person and so on and so forth. The next thing you know, by that time,
the rumor mill.
Brother JoJo got his leg cut off because he took the Johnson & Johnson virus. So those are the kind of things that we need to dispel, and that's why we're here tonight. So we talked about earlier that there are 6 people out of over 500,000 or 6.5 million vaccine that was given out that had an adverse reaction. When we're talking about an adverse reaction, we're saying a serious reaction. We're not talking about the little arm soreness or things of that nature. We're talking about a serious blood clotting disorder. But as Dr. McKinney said earlier, when we were talking earlier, those people had some underlying condition. So it wasn't like, oh my God, I took the vaccine and now I got a blood clot. No, you had something that was going on all along. They pulled that vaccine and we don't know why. It could be political, it could be financial. However, it affected the African-American communities or communities of color the most, because it took away the accessibility and the ability to have those viruses there without being refrigerated and things of that nature. So one of the things that we want to talk to you guys about is the fact that don't allow the headlines in the news, or there's a recall, let's not do this because it's going to happen. But you, like you talked about earlier, you can die. You rather not have the soreness, but you're going to say, I don't want to do it. I'm going to wait. What are you waiting on? What are we waiting on, people? This is not going away. And as longer you wait, the longer you're going to have a probability of catching the disease, because we have those individuals that are not taking the vaccines and may end up with transmitting the virus to you, and you're the one who becomes sick.
Crystal Postel posted a comment. She said, "What keeps why I keep from people around me? They have heard that even if you get the vaccine, you can still get COVID-19." Well, what I want to say is, if you get the vaccine, Crystal, you will not die from COVID. Without the vaccine, you have a significantly increased chance of dying or getting intubated and then having worse complications from the virus. By getting the vaccine, you have less chance of actually getting hospitalized, intubated, and dying from COVID vaccine. So it's not saying, and then there's on the Pfizer vaccine, 5% of the people it will not work for. On the Moderna vaccine, it's 6% of the people it won't work on. But that means 94 to 95% it does work on, and those people will not have an infection that will kill them. He also said, if you get the vaccine, you still wear a mask. That is to protect you from that chance that you can actually still get the vaccine and still get the vaccine and still get sick for somebody who wouldn't take the vaccine. So the transmissibility is decreased with the vaccine. The infection rate is decreased with the vaccine. So your chances of going home to your loved ones with all your fingers and toes and your mind in the right place is better with the vaccine than without.
And I agree with, go ahead. I can't see. There you go. I agree with, Gisselle, because the problem is, like we talked about earlier, you can get the vaccine, just like with anything else. You take the flu vaccine, there's different strands. Just because you're vaccinated against that particular strand does not mean that you won't get another. Like we talked about, Gisselle said that even if you get COVID, it will not be as severe. I would rather take a sniffle, a sneeze, as opposed to being intubated. So those are the things that we are preventing from. People are actually dying. And you got to understand that if you don't take the pill, you will die. So a little side effect will be okay. And we talked about that. You also have to understand that there are rare cases where you can be fully vaccinated and still get the disease. And that will be because of the different variant, and also the fact that you also have some underlying condition and that your immune response is not as great as you thought it would be. So therefore, like Marty said earlier, get your vitamin C, get your workout, stay healthy. We cannot make you superhuman in it by a vaccine. You have to play your part as well.
We have to do our part. That's it. Dr. Horn, you were saying.
Right. I wanted people to understand about the blood clots. So the news was like, all these people had blood clots. The reality is it was 6 cases out of 6.8 million doses. Wow. So take that in perspective. Birth control pills. You can get a blood clot from being on birth control pills. So out of 1 million people we give contraception to, 50 of those people, that is 0.05%, get blood clots. So you have a higher chance of getting a blood clot with birth control pills than you did the vaccine. Cigarette smoking. 0.18% of people who smoke cigarettes get a blood get a blood clot. So you have a higher risk of getting a blood clot from smoking a cigarette than you do from the vaccine. And COVID. 16% of people who catch COVID get a blood clot. You have and lose weight. Right.
Yes.
In the grand scheme of things, those 6 people, yes, granted, it's awful that they got blood clots, but other things that you do in your day-to-day life can cause you to have a blood clot.
And what Jamie, she's talking about 0.0000088%. We're talking about 1/100th of a million %. That's ridiculous.
Come on.
Right. And I want people who have had the problem. Right. I want people who've had the Johnson & Johnson vaccine to rest assured that they aren't at a super high risk of getting a blood clot. I've had 2 patients who've had the vaccine want me to test them for a blood clot.
No, I'm like, there's no indication and there's no reason to do so.
Right.
But there's one of the patients in here who said that they had the Johnson & Johnson. Daryl, can you find that? I think it was Virginia White, and she said that they got it and they would do it again.
Yes,
that is absolutely right. Yeah.
Yes.
Who is that? I had
No,
and I think one of the things that they also said, if you have the Johnson & Johnson vaccine, you don't need to be tested like Dr. Horn said. You don't, and also you got to understand, if you're already 3 weeks out, your likelihood of getting a blood clot is slim to none. Right. So you don't have to run and say, oh, I need to get tested. I need to do this. You're done. You're out of the water. So even with any shot that you will take, you have to go back and talk to your doctor. You will report any type of adverse effects. However, you have the shot, you're 3 weeks out, you're out of the water. You're not going to just miraculously get a blood clot overnight. And so we need to dispel those myths. These are things to stop us from getting the things that we need to do in order to stay healthy. And that's what we need to understand.
Can you address that last question?
Go ahead.
Yeah, that's what
said. She got the vaccine, and after getting the second shot, she was extra tired. And what can she do to get her energy back? So me too, Effie. I was miserably tired. What I did, I went to bed. I took 2 Tylenols, went to bed, woke up, and then did my regular activities. We can start walking gradually, taking a multivitamin, but this is far, far less than what the COVID virus would do for you. you're going to be fine in 12 to 24 hours. If you're not, I would consult with the primary care provider.
That's right.
Run some blood tests for you to make sure you're not having any other adverse side effects to the vaccine. But I'm pretty sure you're going to be okay. But definitely follow up if it's been greater than 24 to 48 hours. Definitely follow up with your primary care.
Yes.
Okay, she on the phone.
There we go. There's another comment that Tony says. She says, I have 2 friends who took the Johnson & Johnson, and they are fine. Black females between the ages of 48 and 55. My sister took it, and she's fine. Now, she got a little swell, but she's fine with that. And that's the good thing, so that we definitely hear the testimonies with that people are fine. And that none of us, like Dr. Allen says, have horns. We still here. We still right here, and that's the beauty of it.
But I think the moral of the story, everybody needs to get vaccinated. It doesn't matter if it's Johnson & Johnson or anything like that. When Johnson & Johnson comes back on the market, everything has a warning. Have you noticed, if you smoke a cigarette, this can cause cancer. You go walk into the store and eat Chinese food, this can cause cancer. We sit up there, we don't even think about the fact that we're sitting up there barbecued in a whole cow, and this can cause colon cancer because we love to smoke our meat. So we're asking for all these little labels to be placed on so they can say, okay, these are the side effects. These are also deterrent. Me as a physician, when I prescribe somebody birth control, do you think I go down and talk about 101, 3,000 type of complaints that every medication have? In that event, no one would ever take anything, because there's always risk associated with every single thing that you put in your mouth or put in your body. So we have to be very cognizant of what we're trying to stay away from. We need to get away from this is also a government conspiracy theory. The government is not vaccinating the whole world for millions and millions of dollars. I read on the internet the other day, oh, this is about money. If it's about money, I'd rather stay alive. It didn't cost me a thing to get a vaccine.
Right.
If you want to be a part of who's getting paid for this? The government isn't getting paid. And if you want to jump on the bandwagon and get paid, buy some stock in Moderna, Pfizer, and Johnson & Johnson. If you think that it's about money, even though Johnson & Johnson is
I was going to say, don't do Johnson & Johnson.
Don't do Johnson & Johnson. However, if you think it's about money, learn how to play the other part of the game. Quit being on that side of just, they're about money. Who has money in the inner city? What money are they trying to take from you? My other thing I was laughing and joking about the other day, in China's associated now with giving the vaccine out with your, I guess it's equivalent to EBT card. So we don't want it to get to a point where they're going to say, here's your EBT, here's your vaccine. We have freedom here in the United States. So why you have an opportunity to do it free, without charge and coercion, do it before the government does step in, and then you will have something to talk about.
Right. Keep in mind, in Southeast Asia, they've been wearing masks on a regular basis since the swine flu about 10 years ago. And so you see them coming over here, you'll be like, why is she wearing a mask? So we can either embrace this and get all vaccinated, or we'll look at a whole of our population that will never come out of mask. You have to make a choice. Make a choice.
Now, how many of you guys been sitting around? We talked about this the other day. I was involved in an incident. I've been fully vaccinated for a while, over 6 months out. So therefore, I have about 98% immunity. Nothing is 100%. And that's what people need to understand. So when people come to you, I got the vaccine and I still got COVID, nothing is 100%.
Life is not 100%.
Right. Life is not 100%, but dying is 100%. Right. So we got to make sure that when you talk about the statistical data, you understand that the only thing that's guaranteed you to do is to die. So if you don't do it, you will die. So again, you sit in this room full of people say, I got my shot. Be careful, be mindful, because they may be lying to you. Dr. Horn and I talked about the other day, there's counterfeit. Talk to him about that, Dr. Horn, counterfeit.
Cards. Yeah. Shut up.
Yeah. Right. So I saw on the news that people are making those counterfeit cards saying that they got vaccinated. So Gwen and I were wondering, how do they track that? Is that another conspiracy theory that, we're all going to be linked to these cards? I don't really foresee that happening just because of the way our government is. I think that might be a violation
of your privacy,
people's rights and privacy. So I don't really foresee that happening. You need to show a card to get on a plane or show a card to get into the movies. But this is the part that I just didn't understand. So you're going to pay somebody for a fake card to say you were vaccinated
when the vaccination
is
free.
to get a free vaccine. Like,
right.
That makes no sense.
Yeah, well, it's okay. First of all, there was a question about people not understanding that it's free. The whole thing is completely free. It's paid for by the government. So nobody can say they can't afford it. You don't have to have any insurance. You can walk in, say you want the vaccine, boom, you get it. Now it is being put in a computer database for you to get the vaccine. The people that are getting cards, these fraudulent cards, are the same people that think Democrats eat babies. They're the QAnon people that think that they're going to be restricted from doing something they wanted to do, but they don't care enough to protect everyone else. So they'll get this fake card so they can keep doing what they wanted to do. Well, there's been no cities that I know of so far that have require a vaccine passport. In fact, Florida made a legislation saying nobody in Florida will require one. But the fact is, when you get this fraudulent card, when I'm going to travel next week, and I'm traveling out of the country, but they're asking you to bring for United that you have proof of your vaccination, because nobody is bringing a antibody test to the airport. But this COVID CDC card can be your passport of passports, so that you can safely get on this plane and say that I'm not putting everyone on the plane at risk. Mm-hmm. But to get back in the country, I do have to have an antigen or antibody test, test to prove that I don't have COVID virus as I'm returning into the United States. So people are doing anything to do a lie rather than do the safe thing and tell the truth.
Right. And I think one of the things that we need to go back and revisit, the concept of a vaccine passport is not new to the government, because back in when they had the flu and people were dying back in the early 1900s, that was something that was brought about and Congress did not pass that. So that's something that has always been on the table. This is where the committee disagreed. I am for that. I don't have a problem with having a card attached to me say that I'm fully vaccinated so I can move around the city freely. I said, because at some time I don't consider that my invasion of my personal rights, but I guess some other people on our committee do, because Dr. Horn and I have about that, talk about that. Just like, I don't care if I do the right thing. I don't care, because the thing about, at least I know I'm around people where I feel safe, because you may come around me and you don't have your vaccine. I'm not safe. I don't want to hang out with you. I don't want to be in that plane. Be able to recirculating air for 4 or 5 hours and you lied about your test or you don't have it. I'm more comfortable knowing that everyone here have a 99% immunity or 98% immunity if I'm flying on the plane with them. And then someone just asked about our booster. Yes, next year, probably, most likely, we will have to undergo a booster. I am not opposed to having a booster shot as well, because again, with every shot, that's why you get the flu every year, because there's different strands and your immunity change. Every year we get older. Do you think you still have the same immune response when you're 20 that you have when you're 50? I am for the booster. So me on this committee, and we like to differ. We're all doctors with different opinions. Dr. Horn don't want to have, a tattoo on her neck to say COVID, that she's been vaccinated. I'd rather have a scan and a test say COVID free, but hey, that's her,
I don't necessarily want to carry a card because I'm going to lose the card. I'm just going to be honest. I'm going to lose the card. But we give up more civil liberties with this thing we can possibly ever comprehend. So if they can put the chip or whatever the information in here and you can track it with that, we give up stuff every day and we don't even bat an eye about what we put on social media that tracks us and gives up all our personal information. So if you want to put that my contacts in an app that I got the vaccine and I can prove it through here, give it here. I'm ready. If that's going to keep all of other people off the plane, come on, I'm ready. They don't even want to wear masks
all the time. When you travel international, there are you have to have certain vaccinations if you're going to travel internationally.
Right.
And we want them to have certain vaccinations before they come over here. So doing interstate, I'm with you, Dr. Allen. It does not bother me. Listen, as long as I'm safe and you safe, yes.
Right. Like Dr. Horn, I'm on Dr. Horn's case because we're the opposite end of the spectrum. And that's why I always invite her on the show as a guest speaker. Dr. Horn travels across the world. She injected with yellow fever virus, malaria pills,
but
all
she's
kind of stuff.
alive.
But she's alive.
She's
but she'll say
alive.
hesitancy on this COVID, but I'm just joking with you, Dr. Horn. But you're right, because when you travel across country, she does more international travel than all of us, and probably has been injected with all kind of stuff, and she's still alive. But those are so that did not take her civil liberty away, because she was still able to travel. That was her choice, because she did not want to get malaria, so she took the pill. She took a shot, so she didn't want to get yellow fever. But we're sitting in the United States, people coughing and sneezing on me, and then I can't take a vaccine, or I don't want to take a vaccine because it's a government thing. I have a problem with that. I also have a problem with the fact that the government is now saying 3 feet away, and we talked about this the other. We sitting here talking now. I just spit all over my screen, and that's and so you're gonna tell me that I can come closer to you? I don't agree with that. Stay away from me. I will continue with my 6 feet distance. I will continue with my mask being covered. I'm in the supermarket, and you guys are still going to the supermarket, and somebody that touched over an apple or orange. I am done. I don't know. I might join Dr. Horn being a vegetarian and grow my own food in the yard and do some crazy stuff like that. So next time y'all see,
but it's healthier. We don't have the pesticides or anything else. We trust the food that we eat. That's coming. We don't know what it's traveled through and what it's. Lots of, and we eat it, and half of us eating it and not even washed it.
Right, we go like this.
Yeah, right. But you know what's going to give me 6 feet, Jerron? I'm with you on that. Give me if we can do 12, I'll be more comfortable with that.
And we have to understand that we have to. When you're in that elevator, right? People take off down their mask. They're talking on the cell phone, and we have recirculated air. You are not fully protected. Get some vaccine. Johnson & Johnson is a recall. However, keep going, people. Keep getting vaccines, because the virus is still out there. We see it every single day. We live with a mask.
I'm curious, how are people in you guys' states with the mask? So I went walking on Sunday. Half the people had masks on, and half the people here in Chicago didn't have masks. It seems like people are getting more laxed. And I went to Michigan, and people were looking at us because we had the mask on. Like, really?
Right.
So how is it in Louisiana and in California? Are people wearing the mask, not wearing the mask?
Dr. McKinney?
Well, it depends on where you go. Because it depends on where you go. I mean, you got even people in the hospital not wearing masks. So
now that is a problem. That's a problem. That is a big problem.
Yeah, it's up. They'll sit at the nurse's station and they'll take their masks off. So, at any rate, on a brighter note, you still have more restaurants are open. You can go out and socialize. There is no 3 feet away in the restaurants because, they're not at the full capacity, but they're getting there. When you're eating and drinking, you don't have a mask on. We have more cover in Mexico and more social distancing there when I was there than we have currently in the United States. And they have more sanitary techniques that they use in other countries than we use in our current state right now. But we are having a nice little surge. It's balanced out a little bit. We're getting a little bit better because more people are vaccinated, but we still have one of the highest rates in our area right now. But it's better than it was. So
that's good.
Yeah, I remain hopeful.
Go ahead,
I think also people have a false sense of security because we run to the little stores and we get the nasal swab. Oh, I got my COVID test. My COVID is negative. If that nasal pharyngeal swab did not go all the way up your nose and make you cry, you did not get appropriate testing. And that's what we need to let people know. So then you're running around with a false sense and a false negative. So you need to understand that if they didn't make you cry, it didn't go up your nose, you don't have a real test. So it gives those people false security. They take off their masks, they gather together, and we are having another surge. And we're having another surge. And people are like, oh, I'm still careless. I'm doing this and I didn't get it. You just happen to be lucky. So, and that's one of the things, you're playing Russian roulette with your life, and this is not going away. So we say, what's going on after Johnson & Johnson? What is our next step? What we should do? The vaccine clinics are still open. If you have already had vaccinated against Johnson & Johnson, you're fine. If you haven't had any side effects, you are okay. If Johnson & Johnson is no longer available and it is not, get on the line, try to find out where the Modernas and where the Pfizer vaccines are, because you still need your protection. And also stay healthy. We talked about before. I sent someone, I think I sent it to you, Marty. We were talking about earlier, your prophylaxis, your vitamin C, 500 milligrams twice a day, vitamin D, 1,000 to 400 micrograms daily. You need a B complex, you need a zinc, and also melatonin, 200 milligrams at nighttime. This combination they found to be prophylaxis. This is put out by Mass General. So we still have to keep our immune system up. We still have to remain to be healthy. And we have to say, okay, Johnson & Johnson was a minor setback, but let's not stop thinking about this virus can actually kill you.
Yes. I want to deal with, real quick while we're doing this, 5 tips with handling your COVID-19 vaccine anxiety. So here we go. We're going to talk about 5 tips for handling your COVID-19 vaccine anxiety. Tip number 1, face your anxiety rather than avoiding it. This is why we do what we do here. We want to help you face your anxiety. Don't avoid it. Avoiding it does not do anything but trip you up later along the line. You got to face your fears, and let's face the reality, especially those of us who have other comorbidities, those of us who have high blood pressure, those of us who have diabetes, those of us who have other coexisting and pre-existing conditions that can definitely throw us off our game. So number 1, face your anxiety rather than avoiding it. Number 2, do your due diligence. Let me say, do your due diligence. That's what we're helping you do here today. Do your research. Ask your doctor. Talk to them about what you specifically need in order to remain healthy. Everyone's bodies are different. Everyone is made up differently. Get the vaccination and do what you have to do your due diligence to make sure that you remain healthy and strong. Number 3, discuss your concerns with someone you trust. We have trusted doctors here who are in the day and life field of this. That's why you hear the phones ringing, because they are on call right now, but they care enough about you to give you this information. Don't trust Ray and them who got their leg amputated. Don't trust Big Mama. We love Big Mama, but Big Mama needs help too, as she in her wheelchair and all that. Listen, trust a trusted and talk to a trusted professional. Number 4, avoid generalizing fear of a COVID-19 with fear of the vaccination. Make sure you know the difference. Yes, we all are nervous about having COVID-19, but don't let that stop you and prevent you from getting the vaccination. And number 5, ask yourself if you have a deeper motivation for being vaccinated. Just like we've been sharing, many of us live in multi-generational homes, and we need to make sure that we're protecting our mothers, that we're protecting our loved ones. It's not just about you, but it's about protecting those that we love. So you can avoid the stigma and avoid the anxiety by doing the right thing. And we want to give you the tools to help you be successful. Thank you. Come on back. That's right.
You know, I wanted to add about due diligence.
Yes.
It's important where you do this due diligence.
Yes.
Gisselle had mentioned earlier about COVID causing infertility. Well, how that came about was put out through an anti-vaxxer. So that was already skewed. What they originally said in the article was that the COVID vaccine attacked a protein, and that same protein was in the placenta, which would cause women to miscarry. But there's been no scientific evidence to prove that. And when they traced the story back, it came from an anti-vaxxer. So I think Google is a good source, but you need to be looking at sources like WebMD, Mass General.
Yes.
Just look to see where you're getting your information from. What your cousin said, posted on Facebook, that really doesn't count unless it has a source. Something from Twitter doesn't count unless there's some type of source. So it's real important where you do your due diligence and get your information from.
That's right. So here's a great question. If you have received the Johnson & Johnson vaccination, can you get a Moderna or Pfizer booster? Well, the boosters aren't here just yet, unless I'm... So talk to us about the possibility of, I guess they're saying, mixing...
you can't. Oh, go ahead.
You could at one point. At one point, you could, if you got a Pfizer, you could get a Moderna second vaccine. But there's no reason to get a cross vaccine now because there's enough of all of them. So if you got a Pfizer, finish with the Pfizer. If you got a Moderna, finish with the Moderna. When they tell us when we can get a booster, I think that's time, but that hasn't even been determined yet.
Right.
They're just forecasting and preparing with research and data to say that next year or later in the fall, when the next virus or strain comes around, that we may need a booster because we are not prepared for this next wave. So.
And also, if you have Johnson & Johnson right now and you are out of it, that's all you need. You don't need a booster. You don't need a second vaccine, and that's what it was made for. So you're protected. So once you're out of your 28 to 40 days, you go 60%. Once you get about 4 months out, again, you're about 98% immune from the virus. So when we talk about that, your immunity means that you may get a little sniffle, you may get a cough, but you will not get the full-blown disease.
That's right.
Some people may get it like we talked about before, if you have some type of underlying condition, but if you get vaccinated, you will not get that full-blown disease. And that's what we're trying to prevent.
Exactly.
I want African Americans and people of color just to understand, let's get away. Let's come away from that myth. Let's come away from the Tuskegee. Give me something else to hold on to make sure that I'm not being vaccinated. Come on, people. Let's find something new. Let's find a new leader. We don't have that anymore. Quit holding on to the past. Let's move forward so we can become healthy. Let's understand that we're new people now. There are things that are put in place for us people not to harm us anymore. So why not take the vaccine? And I still don't understand in the rationale that some of these people give us. We called people and gave them a list and told people, hey, show up, and they still didn't show up. Why you didn't show up? I don't know, just no excuse. And we got to get away. Education is key. We have to educate the people around us that, we just want to live. And I have no stock in Pfizer. I have no stock in Johnson & Johnson. I have stock in life. And I want to live. And I want people to live.
That's right. We had another question by Paula Williams, and we just want to encourage people again. She tells us, with my second dose coming up next week, should I take the next day off to rest?
If you don't want to go to work, girl, no, I'm messing with you.
But yes,
I will say this: if she has it scheduled in the afternoon, let's say she's got it scheduled at 12 o'clock or 2 o'clock, she won't start feeling the symptoms till later on, and she can sleep through that and possibly feel great in the morning to the next day. But if you want a good day off, girl, call in.
Call in.
Because most companies are giving you. Most companies are giving you the day off. I just heard, like, for example, a major insurance company, I don't want to call names, that my sister works for, they didn't tell. This was what's so sad. They didn't tell the black folk. I don't know. They just didn't know they got the second day off paid. So she started making calls. Did y'all know we get the next day off free and that they gonna pay us? But most companies will give you the next day off, and check with your HR. Say, hey, I'm getting the vaccination, and most of you will give that to you without it affecting your sick time or vacation time.
Right. And my recommendation for those like in healthcare, what I did, I took my second vaccine towards the latter part of the day, the 4 or the 5 o'clock hour. That was the best sleep I ever had. I'm not even gonna lie to you. I snored, drooled, did all that kind of stuff.
Y'all are wrong. You should have told me. I took mine at 9 a.m.
But you sleep at 2 o'clock in the morning, 2 o'clock in the afternoon anyway. So you would have fell out at 1:30.
Good point. But by afternoon, I was done.
Look, a good nap ain't never hurt nobody.
Thank you.
No, that was no nap. That was 12 hours. She was still asleep. Okay, there was no nap.
I was done. Marty. How should we address people who tell us, I'm not, Gwen was talking about why people don't get the vaccine. And I know I had discussed this with you guys earlier, but I'm getting a lot of, I'm covered by the blood. I haven't gotten it this far. I'm not going to get it now. What should we be telling people to try to convince them or show them the light that they should get the vaccine?
That's a great question. And if we're going to go biblical, that's going to make me put that hat on real quick. The Bible says we perish because of lack of knowledge. Listen,
There you
get
go.
knowledge right now. You don't have to perish because of that. You've been told by spiritual folk who are also in the profession. If your professional people in your church are telling you, listen, get the vaccination. God put them there for a reason, to be advisors to you. Now, if you don't want to take it, that's up to you, but don't come around me. You keep your sick self and your germ COVID carrying self in your own house, and praise God by yourself, and I'm going to wear the mask. But seriously, too often I think we misinterpret theology and science, and thinking that the two don't mix, and they definitely do. So if that's the case, listen, keep it to yourself. But listen, God gave us doctors, scientists for a reason, and if they're giving us the advice, then let's take the shot.
I agree with you. Take the shot. I guess I work with a bunch of heathens. No, I'm messing with you, Dr. Horn. And
Tell them Jesus paid it all and still get the vaccine.
And then the other reason people weren't getting it is because they were still talking about the chip. And I thought they were joking until I talked to you.
No, people aren't joking.
People believe that.
People believe that.
I'm telling you, that's the QAnon crowd that you cannot beat. The problem we have is that when we're talking about Big Brother watching you, Facebook, every time you answer a question, you participate in a challenge on Snapchat or Instagram, they are collecting data. Every picture you post with your child on the "This is my daughter" challenge and "This is my grandbaby" challenge, data, pictures, information, they feed into that. Those people are getting that information that makes them frenzied about that area. If you want to, and it works on our side as well. We get the information about how somebody has killed somebody, even though that's the truth. How do you differentiate that there's no chip in here when you believe everything on the internet? The crazy part is you'll believe everything Tucker Carlson says, which is a lie, and then you can come over here to CNN and you won't believe anything they say. It's just amazing because, of course, the liberals are killing the country and eating babies.
But we got to do our due diligence and do the right things. We are being the conspiracy theories are killing us.
That is correct.
And that's a whole nother topic. But we have to do our due diligence and listen. Do the research for yourself. Live. Choose life.
And I think so many times that we as people of color are on the end of that train of choosing life. We allow people to choose the life that we want to lead.
Right.
We're looking at other things to say, oh, that looks better on the other side, as opposed to saying that I'm going to take charge of my life.
Right.
And speaking of taking charge of our life, let's talk about COVID vaccine post. What do I do in case of exposure? I have my vaccine. I've been fully vaccinated. New CDC guidelines basically says I do not have to self-quarantine. So if you've been fully vaccinated, you do not have to self-quarantine. I mean, you don't have to self-quarantine for 14 days, but yet and still, you still have to make sure that you not necessarily taking your chip, but just be in tune with your body to understand that if I get a temperature, things of that nature. I talked to you guys earlier about the vitamin C, the vitamin D, the things that you should be taking all along. How many of us do not take just regular multivitamins on a daily basis? We're not eating healthy enough to say that I have enough vitamin C, D, E, K, B, all the, X, Y, and Z. We don't say that. So we got to make sure we're taking care of ourselves. And then also for those individuals who had the shot once and then now have been exposed to someone, you still have to self-quarantine. So because you only have one vaccine, you still have to quarantine if you have that exposure. Be mindful of your crowd. Be mindful of your silo. Because if you have these 5 people that you've been with all the time, and now you invite that 6th guest over to your house with no mask, coughing, and sneezing, self-quarantine. You're not fully vaccinated, so I wouldn't even take the risk. Even being fully vaccinated, we talked about it before, I still wear a mask. In some cases, I wear 2 masks. When I'm in the hospital, I'm like, whoa, I will wear an N95 and another vaccine over, and I'm fully vaccinated because there is still that risk that I can get the disease. So I'm going to protect myself, and again, I choose life.
What if there's even a bigger problem for the people who choose not to get a vaccine and they choose to go around other people? You may be fine, but since you're practicing unsafe practices, your mother may not be fine, your wife may not be fine, your grandmother may not be fine, and you may spread it to other people. It's like these people that go unvaccinated and go to these big events and like the spring break or whatever, and they brought this disease back to their family. People died. It wasn't just that simple. You're young, you're healthy, but you've passed the disease on to other people who were not so healthy. So that's a bigger picture.
Right.
It really is. Oh, sorry, we're all working here. Got some things going. I'm trying to get that QR code for you over there so we can post it for you, Dr. Allen. But talk to us real quick because we're wrapping up. We got about less than 5 minutes. For those who are in Chicago, how can they get Dr. Horn? How can they get the vaccination for free, and where can they go?
So if you're in the southern suburbs, again, you can go to Matson Community Center, or you can go to Tinley Park. If you're in Chicago, just Google COVID in Chicago and all the sites come up. And I know this works wherever you are because my daughter is in Maryland. I just Googled COVID, Maryland, all these places came up online. So I was able to point her in the right direction. And now it is 16 and over. Doesn't matter if you have a pre-existing condition, if you have insurance, don't have insurance. All you need to do is be 16 and over, and you can get vaccinated.
And not think, no, I'm messing with you.
Paula Williams, she says her son is 17. Can he get the Moderna or the Pfizer? Yes. You can get the Pfizer or the Moderna vaccine. You can walk into anywhere. I don't know where you are, Paula, but you can find any place in your area to go get a walk-up with no appointment, scheduled vaccine. If you can't get that in your area, I'm sure there's a Walmart or a Sam's pharmacy that will give it to you. But they're available at CVS, Target, Walgreens, Walmart. You can go just about anywhere, but your local hospital or the Department of Health has vaccines, so your son can go get the Moderna or the Pfizer.
Paula's one of my super fans out of Connecticut, so we love her.
All right, Connecticut. Yes. Can't help you, Paula. No.
But she's also, love Paula because she's also about Black wealth and financial planning. So she's absolutely amazing with that. So yes. Where can they get it, Dr. McKinney, out in Lake Charles area?
You can get it at Lake Charles Memorial Hospital for Women on Oak Park Boulevard. They have walk-up. You don't need clinics. You don't have to have an appointment. You can come in and get yourself registered and get your vaccine immediately. Again, the same pharmacies that I mentioned also have the vaccine, but there's a no-wait walk-in. You just drive into the parking garage at Lake Charles Memorial Hospital, walk on the first floor. They're sitting right there ready to give you the vaccine. You get your shot, and you get your paper, and you go. Period.
Wonderful.
But one person said, a religious person, tell them that the blood of Jesus already paid for it for you, but you still need to take it.
That's right. That's right. That's right. Dr. Allen, I know that Centinela has some information, and we're going to put the link in there as well, but tell us about Centinela Hospital.
Right. Centinela Hospital is located in Inglewood. Every Tuesdays and Thursday, they have vaccines available to everyone. I'm going to see if you can you guys see this QR code? Let me see. Does that work? Oh, does that work out? No.
We see it. There we go. We go ahead. We gave you a solo.
There it is. I don't know.
Put it closer.
I'm going to try to put it on here. Closer? Oh,
yeah.
There you go.
Oh. Is it blurry or I don't know? I don't know.
It's blurry.
It's blurry, but you can also go on Centinela's website. You can sign up for it, or you can hit me up on Facebook and give me your name. All I need is your name, and we can get you on the list for be vaccinated. Your first vaccine, which is Pfizer, and we have a clinic that runs every Tuesdays and Thursday. And this week we will have it on Friday. So if anyone's interested, just come on, or you could just come up to the hospital. Sometimes you don't even need an appointment. We can get to you right then and there.
Excellent. Dr. Allen, I put the copy of that in the chat section. So anyone who's in the LA area, you can definitely click on the link and that'll get you right there for Centinela Hospital. And then Jerron told us that Cal Poly Pomona out here in the IE is definitely giving out Pfizer shots as well. So we just want the people to know, listen, get and Google anywhere. You can Google that with the vaccination and get to your local place. And your county is giving it as well. So check out your county websites. If in doubt, call 211. And that will always get you the information that you need. Well, this has always been Centinela was good, wonderful, extremely organized. Thank you, Tony, for sharing how organized Centinela is with that. So as always, we want to thank you so much for joining us. Dr. McKinney, listen, thank you, darling. We appreciate you. Dr. Horn, in the midst of delivering babies, we want to thank you. Dr. Allen, yes, in the midst of getting house calls and everything else, we can't thank you enough. Good people, please share this link. Host a watch party. This has been very, very informative to give us the real facts about what's going on with the Johnson & Johnson. Yes, it is still trusted. Yes, we still trust Johnson & Johnson if it comes back out. But we want you more than anything to get vaccinated. Thank you all for sharing this information. Virginia, we love it. Yes, thank you. Awesome. Yes, we appreciate you. We'll be back again in 2 weeks, every other week, with house calls with Dr. Allen, house calls with Dr. McKinney, and house calls with Dr. Horn. Again, my name is Martina Sellers. I am your mental health hygienist, and we want to thank you for always joining us with this because we don't want you to secretly suffer in silence in the shadow of shame, but we want to make a difference and eliminate the stinking thinking that has so traumatized our Black community because we don't know enough about our mental health and our physical wellness. Again, but we always want you to speak up, speak out, and live. And always remember to enjoy your life. Until next time.
Enjoy your life. Be free. Live life. Enjoy.